My name is Kaylee Ivy, and this is my speech on why we should close measles vaccine loopholes in school. So, imagine this there's a kindergartner, tiny, bald from chemo, sitting in a classroom just trying to learn their ABCs. They can't get vaccinated. Not because their parents didn't want to, but because their immune system is simply too weak. Now imagine another child in that same classroom, unvaccinated by choice, not because of a medical condition, but because their parents opted out for personal reasons. It only takes one exposure for that immunocompromised child to get sick. And for some kids, measles isn't just a rash or a fever, it can mean brain swelling, hospitalization, and even death. The scariest part is that it's preventable. Vaccine loopholes are giving dangerous diseases a path to come straight back. And when they do, it is not the healthiest kids who suffer first. It's the ones who never even had a choice. Today, I'm going to talk about why this issue matters more than most people realize. How non medical vaccine exemptions are fueling outbreaks, and what we need to do to close that loophole before it costs even more lives. Let's start with what's happening right now. In 2024, the CDC reported that measles cases in the US tripled compared to 2020. That's from their official 2024 outbreak summary. And keep in mind, measles was declared eliminated in this country back in 2000. The thing is, measles isn't just some mild childhood illness, it's actually extremely contagious. If one infected person walks into a room, 90% of unvaccinated people nearby are likely to catch it, coming from a 2023 fact sheet by the CDC. In 2019, New York City had one of the worst measles outbreaks in decades, spreading through communities with low vaccination rates that led over to 600 confirmed cases, according to the New York City's Health Department 2020 outbreak. That wasn't just some distant place, it was one of the most occupied, populated cities in the US. And the worst part is that this whole thing is made so much harder by the pandemic. A report from the World Health Organization in 2022 said that global vaccine disruptions during COVID have left more people vulnerable than ever. We're still feeling those ripple effects. And outbreaks don't just stay in the classrooms. They hit families, clinics, grocery stores, basically any and every public place. One parent's decision can ripple out into an entire community. So, how is this even allowed? Well, right now, 45 states in the US let families skip required vaccines for either religious or personal beliefs, based on a 2023 report from the American Academy of Pediatrics. And some schools don't even ask for proof. You just fill out the paperwork and you're done. These non medical exemptions are especially common in private schools and homeschool co ops, where there's often even less oversight. A 2022 study published by the American Academy of Pediatrics found exemption rates over 20% in private schools. Unfortunately, according to the CDC, that is well below the threshold needed for herd immunity, which is around 95% for measles. But here's the other problem: misinformation. So many parents are being influenced by anti vaccine content on social media. Platforms like YouTube, TikTok, Facebook, Instagram are full of videos that promote fear, doubt, and conspiracy theories. And the scary part is, people tend to trust the relatable influencers more than medical experts, coming from a 2022 Pew Research Center report on how health and misinformation spreads online. By the time a child sees a pediatrician, it is often too late. The damage has already been done online. So, what do we do about it? We need to eliminate non medical vaccine exemptions across the board in all educational settings, including public schools, private schools, and homeschool programs that participate in group activities like sports or co ops. Only medical exemptions, the ones signed by licensed physicians, should be allowed. We've actually already seen this work. In 2015, California passed Senate Bill 277, which eliminated non medical exemptions in schools. And guess what? Vaccination rates went up and exemption rates dropped by over 20%, according to a 2017 report by the California Department of Public Health. And this isn't about forcing blind compliance. In fact, states can also offer vaccine education sessions for hesitant patients and parents, helping them understand the science without shaming them. But the truth is, public health cannot be optional. When your kid goes to school, you're agreeing to things all the time, like following traffic rules in the pickup line or making sure their lunch meets allergy guidelines. Vaccine rules are no different. And the longer we leave the loophole open, the more outbreaks we're going to see. Doing nothing is a choice, and it comes with real consequences. Now, I know not everyone agrees with this. Some people are going to say it infringes on their religious freedom or personal beliefs, and I hear that. But here's the thing: freedom does not mean freedom to put others at risk. We already have tons of laws that limit personal choice when it comes to public safety. You can't smoke in schools. You can't drink and drive, even if you feel fine. And we all wear seatbelts, not just for ourselves, but because it is the law. Vaccines are the same. They're not just about protecting your child, they're about protecting the newborn sitting next to them, the pregnant teacher, the student with leukemia. And legally, this argument holds up. Courts have been consistently upholding school vaccine mandates as constitutional, even when challenged on religious grounds. This isn't about punishing people for what they believe, it's about protecting people, especially the ones who don't have a choice. To conclude, belief should never outweigh science, and personal choice should never put other people's lives at risk. Eliminating these exemptions is not about control, it's about care. It's about protecting the children who can't protect themselves. Think about the kindergartner I mentioned at the start. Imagine being their parent, knowing you did everything right, only to lose them because someone else didn't. Let's close these loopholes and make every classroom safe for every child, not just the lucky ones. Thank you. These are my works cited for every stat I used, my images cited for all the images, and this is my keyword outline. Thank you.